co-directors and co-founders of the center, along with Dr. Naumann. Unfortunately, I was diagnosed with stage 4 lung cancer last May. It spread to my brain, to lymph nodes, to my liver, to my bone, and I am here today so well, with a great quality of life, for 3 reasons, and I just wanted to share them with you today. So number 1, I get amazing, excellent clinical care. I'm under the care of Dr. Advocacy, an excellent oncologist. There you go. I was wondering why that wasn't working. And I received just such amazing care at our cancer center. I go up to Redwood City to get my chemotherapy. I get my medication, my Tagrisso, at the Stanford pharmacy, and I have just such a great experience getting care at Stanford, and I'm just so privileged to have my care here, and that's the number 1 reason I'm doing so well today. The number 2 reason is I'm a beneficiary of clinical research. I am on a therapy that was determined to be more effective in the FLAURA2 study. Instead of just Tagrisso, I'm on Tagrisso and chemotherapy. And that, I believe, again, has greatly benefited me. So thanks to all of you clinical researchers out there for all your outstanding work. And, if you think about those tough days when in clinical trials, difficult recruiting, having any trouble getting patients, think of me. I'm really a direct beneficiary of your work. And thirdly, and again, in no particular order, I'm a beneficiary of basic science. I know many of you are basic scientists here today. I take, as I mentioned, Tagrisso, osimertinib, which is a 3rd-generation tyrosine kinase inhibitor. And again, that would not exist if it weren't for the excellent work of some folks even in this room who contributed to that work. And I really am very grateful and thankful for that. So really, I am here. So if you have a tough day and you're thinking about why am I doing this in this crazy funding environment, think about me. This is what, why we're all here, to help patients. So if you're having that tough day, think about me as a patient and how you can help me. My dream, my oldest is a senior in high school. He's graduating this year, so I think I'll make it to that graduation. But my dream, we were just talking about progression-free survival. My youngest is in 7th grade, so he has 5 more years to graduate from high school. So, my hope is you guys will come up with great discoveries and great advances in not only basic science, but clinical care, and then I can live to see my youngest graduate from high school. So thank you for all you do. Thank you for coming here today. Just a minute ago, I was going to end my remarks there, but just a minute ago, Senator Hirono, so Senator Hirono is the senator from Hawaii, and we'd spoken with her. She's doing a lot of advocacy work in terms of policy for lung cancer, and her staff sent us this note. She unfortunately couldn't record it. Sorry, I can't see. I'm getting of the age where I can't see. This is one good thing about having cancer. I can always blame the brain mets, right? So it says, dated March 11th, Aloha. While I wish I could join you today, I'm glad to welcome you to the 2025 Stanford Center for Asian Health Research and Education Lung Cancer Summit. Lung cancer is the 3rd most common cancer in the U.S., and decades of research and preventative care advancements have helped reduce its prevalence. Yet challenges to access, screening, and care persist, particularly in Hawaii, which is ranked last in the country for early diagnosis. Over recent years, there's been a concerning rise in lung cancer cases in never smokers, particularly in Asian women. This trend is alarming, given that we lack the national screening guidelines to address it. That's why I'm encouraged by CARE's focus on this issue and commitment to combat a disease that disproportionately impacts our communities. I'm proud to be your partner in this work and will continue to fight to ensure important research such as yours is adequately funded and utilized. So thank you, Senator Mazie Hirono, for writing those comments for me to share with you today. But without further ado, please allow me to introduce Dr. Heather Wakelee, who's my oncologist. And it's interesting, I was speaking with one of the leaders of ASTRO, the Radiation Oncology Society, and I believe he used the term rock star when referring to Heather. So Dr. Wakelee is the Winston Chen and Phyllis Wong Professor and Chief of the Division of Oncology at Stanford University and the Deputy Director of the Stanford Cancer Institute.
So thanks, Bryant, and thank you again for always being so open with sharing your story, which I think helps to raise so much awareness about what everyone in this room knows is a really significant challenge and one that we are all making significant strides and trying to make a difference. And so I think you all know that this has been a topic that I've been passionate about for well over 25 years. I was actually talking to someone yesterday. It's like, oh, I just read your 2007 paper on people who develop lung cancer. Oh, yeah, it's been a long time. And we have made significant progress, and yet there's a lot we don't know, and I'm going to come back to that. I get to speak to you twice this morning before we actually get started, and so this is more of the shorter introduction. But when we think about this disease, and I will just say, we're focusing today on lung cancer in people who have never smoked. And that's not to say that it is somehow better or special compared to just lung cancer in general. It's just that there's a whole lot more research that has been done looking at lung cancer where we know that smoking is likely the etiology. And the disease does behave differently. And we know what we're supposed to be doing to screen, even though we don't do that very well as a society. But there's more we don't know about this disease. And that's why we really wanted to dedicate today. And today is a focus on starting to develop ideas about where we should be heading with the research and how we can have the biggest impact. But again, more on that in a few minutes. Mostly, I just want to welcome everybody here. I obviously see a lot of very familiar faces. And when I reflect on this disease and on my job, I'm always incredibly grateful that I get to meet so many truly amazing people who I would never have met otherwise. Unfortunately, it's because they or someone they love is grappling with this disease, where we have been making slow but steady progress. But as I look out over the room and kind of reflect on other folks, it's been a weekend of reflections about this. Paul Kalanithi was someone who many people know of because of his book, When Breath Becomes Air. Sunday was the 10th anniversary of his passing, and his widow, Lucy Kalanithi, pulled together many, many people to honor his memory, so he's been a little bit more, he's always kind of front of mind, but it was very much front of mind this week. And there is also a new foundation being developed in honor of Susan Wojcicki, who is another person who unfortunately developed this disease and passed on. And her family is sort of rallying around her memory and sort of thinking about things. And so there are a lot of people realizing the things that many of us have been shouting out for the last 20 years about the importance of a better understanding why this is happening, how we can find it early, what we can do to prevent it, and what we can do to treat when it's there. And so I think many of us are pulled together, thinking about so many people who have been impacted. And so it's wonderful to see you all here and to be here, but I get to talk more to you soon. So what I'm going to do now is actually, I want to introduce someone who is a remarkable woman and supporter of CARE on the board, who is Danke, who's going to be joining me in just a moment, coming up here. But Danke is someone who has transitioned in her career. She's actually a software engineer who has worked in Cisco, has worked in SAP, but in more recent years has really dedicated herself to philanthropy, and philanthropy across many, many different aspects, one of which we are very fortunate. She has been very passionate supporter of Stanford in many ways. So she's on the board for CARE and very passionate about Asian American health and many aspects of Asian American life. As a supporter of Stanford, she's also on the Stanford Medicine Campaign Cabinet, as well as serving on the Interdisciplinary Life Sciences Center as a very, very strong supporter there, as well. And through those efforts has been a champion of precision medicine, and the list goes on and on and on. Danke, truly phenomenal, and also very engaged community member, doing many things in support of children's efforts. So Southwest Robotics is another one that you're engaged in, and has been a very inspirational person as I've gotten to know you, and really appreciate that. And so she was inspirational in putting this conference together, as well as this was Bryant's idea as well. And one thing I hadn't mentioned yet, but CARE is a group I've been passionate about and involved in for a number of years, recognizing that while lung cancer in someone who's never smoked can happen to anyone of any background in any part of the world, it does tend to happen more in Asia and in people of Asian ancestry. And for that reason, I've been very, and other reasons, I've been very involved with CARE, and recognition by the board of how critical this issue is for Asian health led to CARE deciding that lung cancer was going to be a major focus for CARE. And then Bryant got diagnosed, and the urgency of that became even more apparent. And so it was from that vein that we were thinking, and I think Bryant especially, and Latha, about, and Danke, what can we do to raise awareness? And that's how this symposium grew out. It was this idea of how can we bring everybody together and talk more about that. But I will talk more about that soon. First, I want to bring up Danke Wu, who truly has been incredibly inspirational, and I think CARE would not be anywhere near where it is today without your efforts. So thank you.
Dr. Heather Wakelee for a great introduction. Good morning, everyone. Thank you for joining us at this inaugural 2025 Stanford Lung Cancer Summit hosted by Stanford CARE. It is truly my honor to stand here among all these passionate leaders, researchers, doctors, and advocates, all together here to address this critical issue, never smoker lung cancer. Lung cancer remains one of the deadliest cancers worldwide. For many, its diagnosis comes as a shock, especially consider that 20% of cases occur in people who have never smoked. This form of lung cancer disproportionately affects Asians, particularly women, like Dr. Heather Wakelee mentioned. Well, I'm going to just probably repeat some of the things that she mentioned, because in China we have saying important things we say 3 times. Research shows that non-smoking Asian women are at higher risk, although the reasons behind this remain unclear. While genetics may play a role, there's still so much we have to understand. More than 4 years ago, my mom was diagnosed with stage 4B non-small cell EGFR mutated lung cancer. She had never smoked, not even once. Her story, like so many others, underscored the urgency of this issue. We were fortunate under the expert care of Dr. Heather Wakelee and the remarkable Stanford team. My mom received advanced targeted therapy treatments and focused radiation therapy for her cancer. Today, after 4 years, her health is still stable, and for that, I'll always be grateful. Their work allowed me to spend more time with my mom, a gift I will never forget. However, so many families are not as fortunate. There's still much we need to learn. We need innovations, more effective treatments, stronger clinical guidelines, public health initiatives, and widespread awareness. This is a fight we must continue with urgency. I am proud to have this opportunity to support this through philanthropy. I'm deeply grateful to everyone who made the summit possible today. Your dedication is inspiring, and I look forward to the breakthroughs we will achieve together. Now, it is my privilege to introduce Dr. Lloyd Minor, Dean of Stanford University School of Medicine and Vice President of Medical Affairs at Stanford University. Under Dean Minor's visionary leadership, Stanford has launched a bold initiative to reshape cancer research and care. By integrating Stanford's strength in academic medicine, bioinformatics, and AI, this initiative aims to drive groundbreaking discoveries in cancer early diagnosis and treatment, with lung cancer as a top priority. His leadership is not only shaping the future of cancer research at Stanford, but also influencing the global fight against this disease. Now, please join me in welcoming Dean Lloyd Minor. Thank you.
Thank you very much, Danke, and good morning, everyone. Welcome. I want to join Bryant and Heather and Danke in welcoming all of you to this wonderful summit devoted to non-smoker lung cancer. My remarks will be brief. I really can't say it any better or any more powerfully than Bryant said in his introductory remarks. We don't understand the fundamental reasons why there is this increase in non-smoker lung cancer, particularly among people and women in particular of East Asian descent. And although the therapies are improving, as you've heard and you'll learn more about, there is still so much work to be done. I think we can all be very thankful for the Center for Asian Health Research and Education, or CARE, and also for the Stanford Cancer Institute, for the focus that they bring to these important topics, and for the resources that they and those working with them are able to bring to the table. As Danke said, we at Stanford have a bold vision to create a freestanding cancer hospital and associated outpatient and research facilities. We believe that this is the next step, a critically important step in the evolution of our impact as an academic medical center so well integrated within the fabric of this great research university. And as Bryant said, the future really is about bringing together investigators and research programs, varying and beginning with fundamental discovery-based research, and there's so much more of that needs to be done to understand these tumors, their origin, their genetic basis, and their targeted therapies, all the way up through designing and implementing the most patient-centered, patient and family-friendly delivery system for our cancer patients that can be imagined. There's no better place to do that than here at Stanford. And I would say this is more than a vision, it's a calling. It's a calling for all of us in terms of the impact that we can have on the patients who receive care here and also on the world because of the research we do, the clinical trials we conduct, and the ways that we pioneer the next generation of therapies and of care. So thank you all very much for being here today. I wish you a very productive day and very productive conference. And I hope that one of the things coming out of today's meeting is that there'll be some new collaborations arise from the work that'll be discussed and some renewed enthusiasm for the future and the opportunities that we all have. Thank you very much and have a great conference.
Thank you very much to everyone. So now we've got a little time where I'm going to try to lay out the vision of this a bit more, right? So I think you all know I'm a medical oncologist, and so I get to meet patients at the time that they already know about their diagnosis, follow them through the journey, and think about those treatments. But we know that lung cancer, of course, it's a whole spectrum of what many people working in that world, starting with we don't understand why people get lung cancer. We know a lot about how if someone has a heavy smoking history, where that's causing lung damage, where that can lead to issues. But even there, some people who smoke a lot never get lung cancer. Some people get it from a very early age. There's a spectrum. In the setting of people who develop lung cancer who don't have a smoking history, we really don't have a lot of ideas about why they get it. There's been some ongoing research trying to understand what is the potential genetic link. It hasn't been an easy one to solve. There's not a BRCA or something similar like that. And yet we're honing and trying to understand that. There's something. We know that air pollution likely plays some role, but how to quantify that, what does that mean exactly, there's still a lot of opportunities. We know that if we can find any cancer early enough, we can cure, and lung cancer is no exception to that. So what can we do to better find lung cancer? If we can't figure out why it's happening and with that, figure out how to prevent it, how do we then find it early? How do we improve screening opportunities? And not just from the traditional imaging, no offense to the radiologists who I see over there, but even going beyond that to other things, blood tests, breath tests, other ways of trying to find it early if we can't stop it from happening to begin with. And if we find it early, how do we improve the treatments, right? I'm always thinking about the systemic treatments, but we also need to think about those really localized therapies. So the radiation, surgery, things like that, right? And those innovations are also happening. And then what do we do systemically? How do we improve from what we have? You've heard some testimonials about osimertinib, Tagrisso, great medication. I remember right when I was starting, we were just learning about EGFR. When I was starting, we knew that medications that hit EGFR could work in some people with lung cancer, but we didn't know who they were. And very shortly thereafter, we were able to figure out, well, the people where the Tagrisso, or not, it wasn't that at the time, other medications, EGFR medications worked. It turns out, if you look in their tumor and you study the DNA of the tumor, you can find mutations in this EGFR gene. And then when there's that EGFR mutation in the tumor, then those drugs work miraculously well. But with the first generation drugs, we realized that all too quickly there was often resistance. And we're then able to go back and look at the tumors and the DNA in the tumors and find the specific T790M mutation and realize if we could only hit that, we could make a bigger impact. And so there was a lot of research, a lot of different medications until osimertinib was developed, which hit that. And then realized, oh, you could give that earlier and even prevent that from happening. But then eventually, for most people, that eventually stops working too. And so then what do we do next? And that's where it gets a bit more complicated. So there's not one thing that works, but a lot of research being done on better understanding all those different pathways and mechanisms and what can we do there. And realizing that as we learn more about the targets and how to get them, we still are in a situation where the tumors can go around and do bypass and do different things. And so we're in need of even better discovery of novel ways of attacking the cancer. And then we think about ultimately, how do we as humans ward off most attacks, most infections, most cancers? Well, it's our immune system, right? That innate, what we're born with, that helps us treat all of these things. And how do we really work on that to make that better attack the cancers? And there's been tremendous improvements in the last decade, more than that now, on using immune modulating agents to treat cancers, but they haven't impacted lung cancer in people who haven't smoked in the same way. And so how do we harness that and make a bigger impact there? And it's sort of all of those questions together, right? And you can imagine no one person can do all of those things, but many people working together can. And as talking with Bryant, talking with others, thinking about what can we do more at Stanford? How do we sort of come together to make a bigger impact? We realized, well, the first thing we need to do is to have all of us know what everybody else is doing just here on campus. So because I've been here for a really long time now, I've gotten to know a lot of different people. And though my research has mostly been as a medical oncologist and a clinical trialist, going back to that 2007 paper, which was looking at multiple cohorts of people trying to understand what's actually the incidence of lung cancer in people without a smoking history, and has that changed over time. Right, I've partnered with many epidemiologists, though I do not claim to be one, but they're amazing people, and trying to look at questions from different ways and answer those questions. And so we're going to be, but they don't necessarily know all of the other medical oncologists or the surgeons or the radiation oncologists, so they're people working in the basic science labs. And so how do we get everybody to see what everybody else is doing, right? And the idea being this isn't only going to be a Stanford-only sort of thing moving forward, but just to start, to try to bring everybody together who is part of the Stanford community, for us to have a chance to share some of our science, to then be able to think about, well, hey, that's a really interesting question, and I'm doing this, and maybe we can bring us together. And as we go through the meetings over the next couple days, what we want to get to is a point of being able to think about, of all the different things people are thinking about, how can we maybe prioritize this? You know, where do we think we're going to have the biggest impact to then be able to move forward in a clear direction and have some stronger collaborations? So as we move through the couple of days, we're going to start off first by talking about screening, right? And to think about what are we doing today to screen for lung cancer, and what more can we be doing, especially when we think about screening in the particular populations we're focused on here, which is people who get lung cancer for reasons we have no idea, right? And there is no standard screening, right? That's a spoiler alert there. There's no standard screening except in Taiwan for people who don't have a smoking history. And so how can we think about that? And then we're going to talk and think more about some of those, well, if you do find a lung cancer and you find it early, what can you do? And so we've got our radiation oncologists and our surgeons are going to be featured a little bit there, so you can hear about what they're up to, but they've been doing. And then we're going to be focusing on systemic treatments and sort of what's the state of the art right now. And then we're going to think more about epidemiology. Like, what are we doing to study different populations, and how is that going to help us answer some of these questions? So that's going to be today. Now, my vision, my hope was to pull every single person together. Now, of course, that did not work, right? And so we're missing some really notable folks who are very focused in this area as well, because everybody's very busy, right? And even though this is a top priority, we couldn't really pull everybody together. So it's not completely inclusive, but that was the vision, was to be as inclusive as possible. And at the end of the day today, focusing on those things, hopefully we'll be at the point of like understanding where are we? Like what is the current state of the art? And then to kind of try to summarize that a little bit today so that we've got everybody having a better sense of what other folks are doing, right? And then tomorrow, we're going to be focusing more on where's the future? Where are we heading, right? So tomorrow, the future, right? I was trying to do that, okay. And so we're going to be hearing from some of the basic scientists, see Nathaniel Gray's there, about what is the work that they're doing in thinking about novel therapies. Before that, we're going to be thinking about what are we doing about novel detection, right? What are we doing besides CT scans, PET scans? No offense, those are really important, but how can we move beyond that? Because we know that what we can see with our eyes, which is with AI, what the computer can see as they look at those images, it still doesn't tell us the whole story, right? What can we learn from blood from other ways of looking at the person and at their tumor that's going to help advance the field? So we'll hear about what that research is going on, and then some of the novel therapeutics. And we're also going to hear from some of our earlier investigators. Again, not everybody, but we're trying to get a sampling so we can then kind of move forward. And then at the end of the day tomorrow, I really want us to be focused on doing some brainstorming about collectively, where do we feel our priorities are? How do we as Stanford think that we can make the biggest impact in this area, right? And that's sort of so I'm letting you know about that now. So you can be thinking about that as we go through over the next couple of days. So many amazing presentations. I think that's ultimately where we want to go. And then we're going to figure out, okay, well then how do we as Stanford make this impact, and how do we do that partnering with others? So because there are many other people around the world who are starting to realize how big of an issue this really is. And how important it is. And for most things, almost everything really, you could do so much more with those partnerships and connections than you can as just your own institution or in your own space. So that'll be kind of the next phase. And the hope is that we'll have future symposia, where we are bringing many people together, not just Stanford, but we wanted to start with Stanford focused. So, all right. And I think, rare for me, I think I'm going to end early with that one and pull up Natalie Louie to the stage to introduce our first section. So.